morning. I will be presenting a paper on Delleman-Oorthuys syndrome, a case report of an atypical variant. Delleman-Oorthuys syndrome is characterized by microophthalmia or anophthalmia, orbital cysts, periocular cystic appendages, skin tags, focal dermal lesions, or cerebral abnormalities. Here I am presenting a case of 4-year-old male who presented to us with epibulbar dermoids, upper lid colobomas, and on evaluation was found to have Delleman syndrome. In literature, only 43 cases have been reported so far. So it was the 44th case which reported to us worldwide, and it was one of the atypical variants, which is the first time we were getting it. So the parents brought a child to us with complaint of fleshy red mass of the white part of eye in both the eyes, with abnormally shaped eyelids since birth, delayed developmental milestones, and a patch of hair loss on one side. There was no history of orbital mass or seizures. On examination under anesthesia, we found that there were epibulbar dermoids in both the eyes. There were upper eyelid colobomas. There was microcornea in both the eyes, more so in the left, and there was more than 270-degree limbal stem cell deficiency in both the eyes. On systemic examination, we found there were nodular skin tags on both the eyes. However, there were no tags on the skin as such, which are found in typical syndromes. There was bluish-white pigmentation over the back and other areas of the body. There was large frontal bone and deformed temporoparietal bones. Also, there was temporoparietal alopecia on one side. And on CNS examination, we found a positive Babinski sign. Based on ocular and systemic findings, he was diagnosed to have atypical variant of Delleman-Oorthuys syndrome. We did a MRI which showed generalized cerebral atrophy and enlarged ventricular system with prominent Verco-Robin spaces. Interestingly, the cerebral cyst, corpus callosum agenesis, hindbrain abnormalities which are typically associated with this syndrome were absent in this case, as was the presence of orbital cyst, indicating that this might be possibly be an incomplete variant of the syndrome. As a management, in this case, we only prescribed spectacles. After performing refraction and anesthesia, he was also referred for pediatric and neurosurgical consultation to enable opportune management. This paper highlights the very well clinical presentation of Delleman syndrome. The child in our case lacked the typical features of Delleman-Oorthuys syndrome, based upon which we could have missed the case. The clinical features of Delleman syndrome can overlap with other syndrome, which constitutes a diagnostic dilemma. These conditions include golden hair, Goltz-Gorling, and other syndromes, including the Aicardi syndrome. As a conclusion, Delleman-Oorthuys syndrome is characterized by a triad of involvement of eyes, skin, brain, and hence also called oculocerebrocutaneous syndrome. Individuals with this condition might experience seizures, intellectual disability, and psychomotor retardation. The management is multidisciplinary and could be symptomatic or supportive. The medical management is in the form of anti-seizure medications. Thank you.